Lemsip Max Sachets are over-the-counter medications designed to provide temporary relief from cold and flu symptoms. The active substances in Lemsip Max Sachets often include paracetamol, phenylephrine hydrochloride, and other ingredients to alleviate various symptoms. Indications: Lemsip Max Sachets are indicated for the temporary relief of multiple cold and flu symptoms, including headache, fever, nasal congestion, sore throat, body aches and pains. How to use: empty the contents of one Lemsip Max Sachet into a mug, add hot water not boiling, and stir until the powder is completely dissolved. Allow the solution to cool before drinking. The dosage and frequency depend on the specific formulation of Lemsip Max. Always follow the dosage instructions on the packaging. It is important to adhere to the recommended dosing intervals and not exceed the maximum daily dose. Contraindications: don't use Lemsip Max Sachets if you are allergic to any of the active or inactive ingredients. You are taking other medications that contain paracetamol or other decongestants. You have certain medical conditions such as severe heart disease, high blood pressure, or hyperthyroidism. Special instructions: do not consume alcohol while taking Lemsip Max Sachets, as it can increase the risk of side effects and interactions. If your symptoms persist beyond a few days, worsen, or new symptoms develop, consult a healthcare professional. If you are pregnant, breastfeeding, or have any pre-existing medical conditions, consult a doctor before using Lemsip Max Sachets. Side effects: common side effects of Lemsip Max Sachets may include, but are not limited to, nausea or upset stomach, nervousness or restlessness if contain phenylephrine. Allergic reactions: it's important to be aware of potential side effects and discontinue use if any adverse reactions occur. If you experience severe side effects or any signs of an allergic reaction, seek medical attention promptly.